Okay, we are ready to treat the pelvic floor. So here's your wand. Notice there is a rounded end and a pointed end. You can decide which end feels more comfortable for you. This may have the ability to treat more surface area and therefore may feel more comfortable, but there is not a right or wrong. You can use either end. You'll want to take a little bit of lubricant and apply it to the end that you choose. Some people also take a little drop of it and apply it to the entrance to make the ease of entry greater. So take the wand, go ahead and enter layer 1. If you find that you've got discomfort through this region, focus some time here at this first layer. I'm going to take that first layer off and we can go inside the vagina. So I've entered, I'd be sitting here. Let's turn it this way so that you can see. So now we are at layer 2 for the depth layer. Imagining our clock again, I am at approximately 5 o'clock. If I move this direction, yes, 5 o'clock. If I go this way, it's 4, this way it's 3, and all the way up here it's 2. So let's come back down. Depth layer 2, depth layer 3, depth layer 4, all at the clock position of 5 o'clock. I can come to depth layer 2, 4 o'clock, 4 o'clock, 4 o'clock, 3 o'clock, 3 o'clock, and coming back out, 3 o'clock. Be sure to reach all the way up here to 2 o'clock. This is a hip external rotator, which can be problematic. The name of this muscle is called the obturator internus muscle. For a lot of people, that is the culprit of their pelvic pain. So, coming to the other side, just for demonstration purposes, I'm at layer 2, 7 o'clock. Layer 3, 7 o'clock. Layer 4, 7 o'clock. I would do the same exploration where I might move up to 8 o'clock or 9 o'clock, exploring the depth layers and treating them. To make things easy and more efficient, I like to have people go inside, explore one side. Whoops, these models fall apart. You can go inside and explore the pelvic floor muscles and decide maybe there are 3 really key points on one side. Treat just those 3 today. You may pick 3 on the other side to treat today. Maybe tomorrow you go to a different area and treat just those 3 on one side and just 3 on the other. So how do we treat them? You can take your wand and press into the muscle, just like when you have a knot on your shoulder and you apply some pressure to it. The wand is an extension of your fingers, so press into the knot. Anywhere that you have tenderness, press into that tender region and hold for about 30 seconds, maybe up to a minute. Press just enough that you can tolerate the pressure. As that pressure eases, apply just a bit more pressure. When that discomfort eases, apply a little bit more pressure. You can do that to all of these different spots. A second way that you can treat is to apply some pressure to the tender point and then imagine dragging that tissue towards the entrance. It's a way to stretch those muscles. If I were to take my thumb and imagine this space right here, when I apply pressure to that region, I have bent that tissue and caused a stretch. So that's what you would be doing in here when you apply pressure and drag. You would apply that pressure and drag that tissue as a means of stretching it. I hope that's pretty clear as to how you can treat the muscles of the pelvic floor and treat this hip rotator. There's also a PDF so that you can rehash the information.